Thank you everyone for joining. I'm Hannah Wilkerson. I'm the External Relations and Creative Manager for the Children's Environmental Health Network. And for many of you, I am the one who has been sending you lots and lots of CEH Day emails. So thank you for introducing yourself. But before we begin, I want to set some expectations. Please be as comfortable as you can on Zoom. This is really your time as partners and potential partners. Feel free to have your cameras off or on, however you prefer. If you have questions or comments, please chime in. I know I can talk fast and I'm going to be talking a lot, so please don't be shy about jumping in. But I'd like to start with just a general poll of how familiar folks are with CEH Day. I know we've got some new folks and some folks who are experienced at it, and I'm sure we have lots of folks in the middle who are just looking for like an actionable place to jump in. You can feel free to unmute if you don't want to type it in the chat too. Either way.
I'll jump in. Hi, I'm E, and I'm new here, new to CEHN. I'm here because Becca, who's also on the call, shared this information with our organization called Rochester Ecology Partners. And so I'm not a 1 because Becca's not a random person to me, but I'm not quite a 5. But I am excited to learn more. And I did some peeking through on your website, so I'm a little bit familiar, but I'm new here. So thanks for having me, and I look forward to learning more.
Awesome, welcome. Anyone else want to chime in the chat or by voice?
I can just add for OSU. I feel like maybe an 8. Because we've done it for 2 years, but I still feel like every year we're learning more and adding more and trying to do different things. So maybe if I'm being confident, an 8, but I still feel like we're still learning.
That's fair. Yeah, I feel like it changes each year too, and it's grown a little bit more each year. So yeah, that's great. Just to give you all an overview of what we'll be talking about today. So start with check, already doing it. Welcome agenda and intros. We'll talk through a very brief history of Children's Environmental Health Day, an overview of what being a partner means. And then I'll talk a teeny bit about CEHN's plans for 2024. And then we have some awesome partner speakers who are joining us. And then at the end, I want to leave plenty of time for questions, brainstorming, and a more informal conversation. But real quick, I want to say thank you to the partners who have joined us today to share a little bit about their experiences. I'll let them handle their introductions when we get to that point. But Pecola Abele, Director of Healthy Learning at Women for a Healthy Environment, Katrina Korfmacher, who is the Director of the Community Engagement Core at the Environmental Health Science Center and Professor of Environmental Medicine at University of Rochester Medical Center, Dixie Jackson, Administration Core Project Coordinator at Oregon State University, Advancing Science, Practice, Programming, and Policy and Research Translation for Children's Environmental Health Center, or ASPIRE Center. And Haley Hatfield, who is a research fellow at the Center for Children's Health Assessment, Research Translation, and Combating Environmental Racism, or Charter. So very quickly, Children's Environmental Health Day was first recognized in 2016. It's a platform for all children's environmental health advocates, and it is a day to drive action to improve health outcomes for all children, increase the visibility of children's environmental health issues, celebrate the movement's wins over the past year, and collaborate on the challenges ahead. So while CEHN staff like me help to create promotional materials, encourage outreach, and help facilitate events, we really want child health advocates like you to know the ownership you have over CEH Day and how it's recognized. Since children's environmental health touches so many other disciplines, there are myriad opportunities for how the day can be leveraged to support your existing work. So partners are a big part of what makes Children's Environmental Health Day so special. Partners collectively amplify children's environmental health concerns and drive action for positive change by encouraging a groundswell of activities off and online. They really run the gamut of disciplines, fields, roles, and interests. Partners span public health, healthcare, housing, national schools and childcare organizations, health advocacy organizations, environmental groups, child advocacy, equity, environmental justice orgs, youth-led climate action, and on and on. There are plenty from other sectors as well. So far in 2024, we currently have 158 official CEH Day partners. The logos here are just a teensy portion of them. Partners can be individuals, national, state, or grassroots organizations, offices, business, or coalitions. Really, it's anyone who is advocating for cleaner air and water, safer food and products, and or healthier places for children to live, learn, and play. The children's environmental health touches on so many fields and interests, and being an active CEH Day partner is a great way to find and amplify common ground to increase reach to other engaged and aligned audiences. So we help this by placing partner logos on the CEH Day site, regular partner social media shoutouts, partner spotlights in our monthly e-newsletter, and amplification of CEH Day partner events, activities, initiatives, and fundraisers. So most importantly, partners are welcomed into a broad, engaged, and diverse community of other like-minded individuals and groups working for similar positive change. So what it means to be a partner, the actions that are needed, we ask a few things. We know everyone's comm teams have their own priorities and everyone's bandwidth is already tight, but we do ask that partners engage in the ways that they're able, specifically by choosing at least one item off the menu you see here. So that can be we've included lots of handy toolkits to make each step of this process as light as possible. And I do have a list of them, but I cannot do more than one thing at a time. So I will share a list of all of the links at once rather than dropping them in as I'm chatting. So the first item here is partners help us with outreach. The CEH Day Communications Toolkit has lots of ready-to-use messages, Canva templates, and ideas for creating your own. And you'll find that we add to it regularly. So we've got a blog and an op-ed that will be coming soon that you can adapt. And you can also just follow on social media and reshare posts. That also really helps boost visibility, or boosting posts from other CEH Day partners. Like I said, there are lots to choose from, and you probably already follow some of them. Number two, partners encourage CEH Day proclamations at the city or state level. So proclamations are a public declaration of support by mayors and governors for children's environmental health in general. They can be used throughout the year to leverage advocacy efforts. The proclamations toolkit on the site makes it really, really easy. So some partners aren't able to request proclamations themselves, but instead they pass the request on to members or their audience. The comms toolkit includes some sample messaging for that as well, so it's very quick and easy. Number three, partners join the annual CEH chat. This year we'll be chatting on X like usual, but we'll also pose the questions as posts on Facebook, Instagram, and LinkedIn. Still discussing this internally, but I think this year's chat is going to focus on the mental health impacts of children's environmental health issues. Number four, partners join or host a CEH Day event or activity. This can mean lots of stuff. So it can be everything from penning a blog post, participating in a health fair, sending a CEH Day edition of your regular newsletter, hosting an art contest, planning a webinar, attending a town hall. Possibilities are pretty endless. In a bit, I'll talk about our plans for this year, and our partner speakers will talk about the way that they've engaged in the past. And I think some folks are going to talk about how they plan to engage in 2024. But there's also going to be time at the end, like I mentioned, for some brainstorming. And number five, partners help put a face to children's environmental health movement. So in the partner confirmation form, which we'll get to in a second, we ask for a quote, staff photo, or short video. And this helps us create a more human connected movement for children's environmental health. So these get used in social media posts, partner spotlight, articles, newsletters, and beyond. So the first step of what's next is, after we jump off, of course, is to fill out the partner confirmation Google form. So we use this form to collect contact info, organization website address, your logo, and other helpful info. It also goes over everything I just covered very quickly, and includes links. So in addition to affirming your commitment to the responsibilities you're able to meet, it also keeps everything in one place. If you or your organization were a 2023 partner, which it sounds like several of you were, it's still helpful to have this information, and we really encourage you to fill out the form. So other actions that could be taken now, it's a great time to put out a save the date post on social media and or request a proclamation from your mayor or governor. So each of those activities takes 5 minutes or less. I think they're about 15 minutes between the end of the call and the top of the hour. So if you don't have anything planned for those 15, it's a great way to jump in. And finally, if you're not already receiving CEH Day newsletters and email updates, it's a great time to sign up. I'll share the links for each of these actions as soon as I stop talking. So Lastly, I want to talk a little bit about CEHN's activities. So CEH Day is meant to be owned by the people and organizations who celebrate it. We all come to the day with different capacity and unique audiences and needs, and we'll leave time for questions and collaborative brainstorming at the end, like I mentioned, but past attendees have also told us it's helpful to hear about the ways others engage with the day to get some creative juices flowing. So each year, CEHN hosts an award celebration honoring outstanding leaders in our field. This year, we're excited to host another in-person awards reception in Washington, D.C. The party will be overlooking the wharf from Levee on October 10th at 5 p.m. with lots of networking and community building time, food and drink, and we hope you'll join us. The sign-up link isn't out yet, but it will be soon. And then we've also developed action guides for childcare providers, teachers, librarians, and we're working to mobilize these child health leaders to raise awareness and drive action with some age-appropriate activities like postcard writing campaigns, anti-idling policies for childcare, and eco-healthy read-alongs. So we've worked with the American Public Health Association's Eco Bookworms to put together a list of eco-healthy reading options and age-appropriate questions to discuss. And then childcare providers, teachers, and librarians can even receive a free environmentally themed picture book by entering their children's artwork in an art contest this September. And then you all have heard me speak plenty, and I'm happy to answer questions later, but I want to turn it over to Pecola Abele, who's the Director of Healthy Learning at Women for a Healthy Environment. And she'll talk a little bit about the way that they've interacted with CEH Day in the past years.
Thank you so much for the introduction, Hannah. So like she said, my name is Pecola Abele. I'm the Director of Healthy Learning at Women for a Healthy Environment. And I just wanted to welcome you all here. Thank you so much for being here. So Women for a Healthy Environment is very proud to be a past and current partner of Children's Environmental Health Day. As a nonprofit organization, we empowers underserved communities to build resilience, promote equity, and safeguard children from environmental health hazards. Our collaboration with families, schools, and early learning centers aims to create healthy environments where children can flourish. So specifically some things that you can do to get involved and things that we did. So like Hannah mentioned, there are an amazing amount of resources with the toolkit. So I used the toolkit last year. That's what I utilized, and it allowed me to actively participate in CEH Day. So some of the things that we did, and for the city of Philadelphia, our team was able to successfully secure a proclamation from Mayor Jim Kinney at the time. For the city of Pittsburgh, similarly, we have two teams, Philadelphia and Pittsburgh. Our Pittsburgh team attained a proclamation from Mayor Ed Gainey. We actually had the opportunity to meet with him and his team and discuss the importance of eliminating environmental hazards where children live, learn, and play, and how Women for a Healthy Environment is involved in that work. And additionally, we were able to receive another proclamation from Governor Josh Shapiro for the state of Pennsylvania, emphasizing the significance of our cause. Another thing that we were able to do, we were actually able to promote the air quality flag program that the EPA promotes. So we were able to provide flags to schools and early learning centers to help staff and children understand what that current air quality is. It helped them stay informed about when it's ideal for children to be outside playing for outdoor activities. And we continue to give out flags to schools and early learning centers now. And we also send out regular email blast whenever the air quality is bad. So today in the Pittsburgh area, we're on an orange. Air quality is bad, there's smoke. So we are letting the childcare providers know that the children should not be out if they are a very short limited time. Also, in addition to air quality, our Philadelphia team wrote a report about reducing particulate matter in early learning centers. So the city of Philadelphia provided air purifiers to early learning centers, and we were able to go in there and monitor the centers to see if the purifiers were making a difference, and they were. We were reducing particulate matter by up to 83%. So in the Pittsburgh area, we actually supply some centers in environmental justice areas with portable air cleaners to help reduce their particulate matter. So for this year, Women for a Healthy Environment is going to be focusing on clean water. And currently in Southwestern PA, we put out mini grants for childcare providers to get their centers tested for lead in water and paint, and then we remediate it. But to make this a statewide effort for Children's Environmental Health Day, we are going to provide zero water pitchers to any ELC while supplies last throughout the state of Pennsylvania. So yes, so we're going to help make sure that everyone has clean water. So that is what we're doing this year, but I want to thank you all for your attention, and I'm really glad that you are here and you want to be partners to create healthy environments for our children, because I feel like we all have the same mission. So thank you for listening.
Thank you, Pecola. Katrina?
Sure. Can everyone see that okay? Maybe?
Cannot see your screen.
Okay, we'll try again. Strange. How about that?
Yes.
All right. We'll do it from the beginning. How's that? Okay, so thank you so much for inviting us. And when you did ask us to participate, I said, well, gosh, I don't feel like we did that much. And we had such few resources. I don't know if you really want to include us as a model. But then so graciously, Hannah said, well, that's actually good, because if there are groups that feel like they'd like to do something, but they don't have staff time to devote or whatever, it's really good to see, you know, how easy it is to use the toolkits and doing a lot with a little, and also getting inspired to do more this next year. So I want to thank Becca Lozon, who is on the call, who helped make a lot of this happen, and Maddie Holodnik, who's going to be working with us to do even more this year. So we are an environmental health sciences center at the University of Rochester. We're funded by NIEHS, and these centers are required to have a community engagement corps, which is us. And our role is to share environmental health research with community audiences, and also to encourage research that addresses community priorities. And we focus on all four of these audiences: communicators, educators, community educators, policymakers, public health, and healthcare professionals. So we have a really rich, well-developed network of internal and external partners around environmental health, including the Finger Lakes Children's Environmental Health Center, which is part of the New York State Department of Health network of children's environmental health centers around the state. They provide clinical services, outreach, and education. So they both provide services to clinicians, healthcare providers, and do public outreach. And we've been trying to figure out how to work together. Both of our groups have partnered independently with CEHN for decades, but we're always looking for ways that we can complement each other's efforts. And this turned out to work out really well, because FLIXI, as it's called, had organized several events, including the Mayor's Proclamation, which I'll get to in a minute. And we certainly wanted to support those efforts. And because we had some staff resources, we were able to kind of collect all of the things that were related to children's health that were either coincidentally or by design happening then, and pull them together under this sort of marketing umbrella of leveraging things that were ongoing. So on Wednesday, October 11th, there was an internal webinar, which is part of FLIXI's ongoing webinar series for clinicians and public health professionals in that region. And so there was a talk already scheduled by Dr. Woodruff, who's awesome. And if you know her talks, are very inspiring. And, you know, this was a real star-studded event. So that was a great opportunity, through the beauty of Zoom, to have the mayor's proclamation read to an audience. Because it's one thing to have a mayor issue a proclamation. There's another for anybody to ever hear about it. So given the state of journalism in many places, we didn't know how that was going to happen. So we leveraged this opportunity to really highlight that. Because the mayor wasn't available, Councilmember Mitch Gruber did that, sort of sharing and spreading the awareness of this to a larger group of elected officials. So the next day, we have an ongoing basic research seminar series in our department, and the researcher who is presenting on PFAS is focusing on maternal and child health, breastfeeding duration, and human milk. So that worked out really well. And then at the same time, Another Flixie talk for the public was also happening remotely in our Got Health series, with sort of an overall of tips of protecting children from harmful exposures. Also reaching out to internal partners, we discovered that some of our colleagues in pediatrics were planning to table at our public market, which a lot of people come through on a Saturday morning. This picture is not of that event, but it is at the market of other things we do there because it's a great venue and we often engage with people there. So this was a public audience and it was a way of bringing together pediatrics and environmental medicine to do that. I also had to highlight that by doing this together, we were able to leverage our internal marketing. The University of Rochester is the largest employer in our city. It's a pretty big place. But being able to package these materials in a way that got the attention of our communications department, let us get that on our At Rochester bulletin, which goes out to, like 30,000 people in the city. So right there, that was really helpful. So that was the point. I wanted to make 2 points here. One is that there was just like a stone soup. Like we put in the stone of we will bring these things together, and everybody just had to bring a carrot or a potato or whatever to make a really lovely soup. And also we were able to then leverage that by talking about all of those events together in our newsletter, which you can find on our website. Flixie also advertised this through their website. We got it into our university-wide communications and social media of all those entities. And I wanted to highlight that the other side of that is that it also brought us closer together with those groups that we were partnering with. So for example, when we developed this playmat material this spring on why should I play inside today, a material for children around what they should do when there are wildfires and explaining why they may need to play inside, which was a need identified by community partners. We then leveraged the Flixie resources that they had separately developed about those to point to this. And so we had a collaborative material. And so it really strengthened our relationship with our partners while enhancing the visibility of the Children's Environmental Health Day. So here's the contact information for the Flixie Center and ours as well, should you wish to follow up with any of those things. Thank you.
Thank you so much, Katrina. And if the speakers are okay with it, we can also share slides out afterwards so folks can have copies of that. But there's also speaker info in the link list that I'll share again. Now I'll pass it over to Dixie.
Hey there, let me go ahead and just see if I can share my screen. Can you guys see that all right?
Yes, we can.
So I'm Dixie Jackson. I'm the project coordinator for the OSU Aspire Center, which was that very long name that Hannah was saying earlier in the introductions. But as you can see here, it stands for Advancing Science Practice, Programming and Policy and Research Translation for Children's Environmental Health. We are one of the 6 centers for children's environmental health and research translation funded through NIEHS. So we have been a partner for CEH Day since 2022. And so I'm just going to show some examples of what we've done to participate. So one of the main things that we have done is the social media promotion. It's a really easy way to hop in. Even if you're not sure yet what activities you want to do or what you want to take part of, the toolkits that are already developed, as you can see, we've used the images here, and it's just makes it very, very easy. In 2023, after our newsletter got started, we were also able to promote CEH Day through our newsletter. This year, we're pretty excited because we're going to be working on some collaboration with EPA Region 10 to do for Children's Environmental Health Month, a social media campaign. So I'm not quite sure, we're still in the early part of that, but very excited to see how that takes shape. We also, in 2022 and 2023, took part in the CEH Day chat, which is another very easy way to jump in and just be a part of it. We did that both years and plan to do it again this year. And as you can see here, you know, I tried to just give some examples of how we've answered the questions. I would say one of the main things is if you haven't done a chat on social media, I think initially we were very worried about, oh, we need to answer every single question, and it does move very quickly. So it's nice that we are able to get those questions in advance and really give some thought to them. But then we realized, hey, if there's 10 questions and we answer 8, that's great, because it does move at a pace faster than you maybe initially think it will be. But it is a great way to take part. For our own activity, our own event that we try to align with CEH Day is we host an annual Ignite event. And so what this is, I've just kind of put up some examples of what those have looked like both years. This year it will actually fall on October 10th on CEH Day directly, which is exciting. But this is an event that it's just a great opportunity for researchers, mostly our pilot project awardees. So part of our, what we do at Aspire is provide pilot project funding. And so this is a great way for everybody to come and give, you know, a very short presentation. They're usually 5 minutes or less, and just let the audience know what they're doing. You know, they're all working to better children's environmental health. So it's quite exciting, and they are able to come together and find collaborations and other folks who are interested in their work. So this is always an exciting event that we have planned. And again, we'll do it again this year on October 10th. In 2023, we also added some additional social media. So CEH Day aligns pretty well with the National Lead Poisoning Prevention Week. So we did a real push for social media for NLPPW. In 2023, we also added attendance at the OPHA, the Oregon Public Health Association Conference, which is in October every year here at OSU. So it's really convenient, and it just being in October aligns really well. I think this year it's October 7th and 8th, but we were able to table it that last year, and it was really successful as far as just getting the word out about children's environmental health. And then this year we're adding another event, the Coordinated Care Organization Conference, and that will be October 2nd, I think. And so for us as partners, I would say, you know, it's a great opportunity not only to connect with CHN, the other CERT centers, and other CEH Day partners for shared messaging around children's environmental health. But it's also, if you have activities, it's a really great way to promote your own activities as well. Since everybody's very tuned into it being CH month. And then advice for any new partners coming on, I would say, don't bite off more than you can chew. I mean, we started with just social media and Twitter chat, and we were like, that's pretty good. Our Ignite kind of aligned with that. And then each year we've been able to add a little bit more, and hope to do so again this year. So that is, you know, would be pretty much our main advice. You can always add more later. And I will stop sharing. Thank you.
Thank you, Dixie. That was great. I really like your advice and the picture. I'll pass it over to Haley.
Can everyone see my screen?
We can.
Awesome. Okay, so I'm Haley Hatfield. I just wrapped up my PhD at the University of Georgia, but I've been a charter research fellow these last 2 years. And just real quick, charter is also one of the 6 CEHN centers, similar to the OSU Aspire Center. But we're a joint effort between Emory University, the University of Georgia, and Spelman. And where I'm at UGA, it's a little different. We're not public health experts at all. We're more focused on the research translation aspect of this center because we're housed in the School of Journalism and Mass Communication. And then in particular, we work with emerging technologies like virtual reality. And so altogether, we kind of lean on everyone for our expertise to do different things with the center. But similar, this isn't okay, sorry, it was slow. I won't go too in detail. I think Dixie gave a good job about talking about the chat and just the resources that are available. Because our first year we dived into Twitter and the different social media strategies and the toolkit that's available. And like she had said, there's question prompts that are given prior, and so we were able to really plan ahead about which questions we wanted to answer and how we wanted to engage. And so that's really what we did, and we all just kind of worked together, posting on our personal pages as well as sharing and engaging with other posts and everyone else that's participating in this. And we were just emphasizing our center with the research and community partnerships. We also called attention to our communication backgrounds and how we're using research translation, and then also highlighting cross-center collabs. So it is like a good way to just kind of talk about what your group is doing while you're integrating it with the CEH Day. Then the following year in 2023, we really wanted to try to, I guess, engage kids on CEH Day because the toolkits are great for engaging, I think, more for adults or parents. And so we actually, if you know any middle schooler age child these days, they are on Roblox. And so we get to work at UGA in a pretty unique center with the emerging technology. I worked with 2 high school interns, and we created a Roblox world that focused on the children's environmental health. And as I mentioned, the 6 centers, we were kind of our starting point and how we are designing this world. And so one of the centers is UPenn. They focus on asthma related research. And so we have a room. The world is a home. And then there's different rooms are all focused on a certain indoor trigger or hazard. And so asthma, we had like pet dander floating in the air. NYU does some research on lead paint. And so in each of these buttons you can like click on and interact with, and I have a brief gameplay in a second. And then like University of Southern California has some mold research. And so just trying to highlight these different aspects for kids to learn about their environmental health. And then here's a brief clip. It's about a minute. It's super sped up so that it's not that long, but the goal was that they would have to find all 10 interactive elements, and then they'll click on, so that was about gas stoves, indoor smoke. Sorry, it's really fast. But here's the lead paint. And so what we did was we opened this up for, we kept the promotion initially small, just within our center and our community partner groups. And so we launched it on CEH Day as an interactive event. And so there's about maybe 10 of us in there all at once, going around and learning and just kind of interacting with this world. But since then, we've learned a lot, and we continue to make updates. So I will say my 11-year-old niece is my like harshest critic when it comes to these worlds. And she told us that it wasn't that fun to just click and read things. And so what we've done since last year is we've added an obby, so like an obstacle course that is still themed to these different health hazards. There's a maze where there's like these like green asthma things that come after you that you have to try to beat to the center first. And then we also wanted to include some knowledge assessments So there's question prompts that they have to go through the correct door, and they'll reach the end and get up like some points for that. So that's what we're hoping to continue doing. We've also been ramping up our social media and just promoting it more widely. We did also try to do another event for Earth Day, and we got more engagement with that. Just because Roblox is an online virtual world, there's millions of people on there. We've kept it pretty small initially, but we're hoping to continue to ramp this up and do a little bit more promotion this year, and definitely collaborate with our 6 centers and whoever else may be interested in sharing the event. But we'll do another Roblox virtual event this year. And then that is all I have.
Awesome, thank you. I'm gonna drop the Know Better, Live Better link into the link list as well, because it's really cool. But the rest of the time is really y'all's. So whatever is helpful, if you have questions for speakers, or if you want to brainstorm or like talk through your thoughts on CEH Day this year, the floor is open.
I have a question for any previous participants or partners in how their engagement with any of the like social media campaigns have been specific to this initiative. Does anyone have any? Did you see that the engagement went well? Were they like not really interacted with? How did that go for you?
I can jump in. I mean, I don't have much of an answer because our social media, we're a brand new center, so we just kind of got started from scratch when we received the award for the CERT Center. So that is part of the learning process as well. So we really didn't do a lot of monitoring the engagement with it, because we know, Facebook, it tends to be very low. Anyhow, for our center, does better on Twitter. And we haven't had an Instagram the last 2 years, but we do have one now. So, and that I think has been a more successful venue for engagement for us. So hopefully adding that this year will make a bit of a difference.
Thank you, Dixie.
I can speak maybe to the social media strategies. Just with like hosting an event and online, I guess we've realized doing an event for kids online, it's like you do have to go through parents first. And then parents usually don't know like their kids' usernames or how to log in. So we've had some issues trying to find out like what's the easiest way to get people involved and get them online with us. But we've learned that like having a set strategy ahead of time, like to start posting at least like a month in advance, has helped grow our engagement. Because I think the first time we did it, we started posting maybe the week of, and we just weren't really getting that much. But we've started a lot earlier and just kind of start putting that out there for our audiences, and then it's grown that way.
I have a question for Hannah.
Sure.
So at least initially, because we do a lot of children's environmental health work, but that's not all we do, that this really what motivated us to participate was to lift up the work of our partners who do children's environmental health, and particularly of CEHN. So I wondered, what is most helpful to you as an organization, because of all the wonderful things you do. I look at this as also a time where we can all celebrate your work and make sure that, we spread awareness of all the great things CEH does. What is most helpful to you?
I really appreciate that. I think, so this is actually, it goes back to E's question as well. I think it really does help boost, and it's cool to see so many different partners. posting their own take on children's environmental health. I personally love having a library of like resources and events and recordings that I can point back to for introducing people to children's environmental health as a concept or environmental health as a concept, and being able to point to all of these partners and show that it is like this big wide web that is doing so many different things, from air purifiers and daycares to like researching wildfire smoke to like so many different aspects of it. Like last year we had federal agencies join for the first time, and some sustainable businesses, which added a whole different flavor to it. So I think having that wealth of content is, indescribably helpful to be able to point to and to be able to lift up what everyone is doing. And then that creates this like kind of growing harmony of all of the different ways that children's environmental health interacts and how people can get involved with it. Because I think one thing that I personally, and I think CEHN and many of us in the community struggle with, of like communicating science in a way that is not overwhelming, or like children's environmental health specifically, because we all want to take care of children. We all want the best for children, and it gets very hard sometimes not to feel overwhelmed by that. And I think having so many different avenues makes it a very friendly way to get involved with that.
Can I ask a follow-up question? From that perspective, to join in your campaign, you need one organization. And as I described it, we were several different parts within one organization, and we all had to agree for one person to be the lead and say the University of Rochester, which is, was a little bit of a challenge at first, I think, but ended up being great because, as I described it, brought us closer together. But what if, say, other partners in Rochester, like ACE Group, are also celebrating Children's Environmental Health Day? Does it make more sense for us to all come together as Rochester is celebrating CEH Day, or multiple institutions within Rochester to be celebrating separately as independent partners?
I would always encourage collaboration. And if there are ways that I can set up our like any intake forms or the map or anything like that to help articulate that better, please let me know.
Just don't want the mayor having 5 different people asking him for a proclamation.
Yeah. I think that level of communication does get really difficult, and I'm glad to hear that it brought you all closer together. But yeah, I think finding those collaborative ties are really helpful and kind of what the day is about. Well, any other questions or thoughts or suggestions? We are always looking for ways to improve CEH Day, and how new partners, potential partners, and returning partners engage with it. Anything else?
Hannah, just out of curiosity, how would you say that most partners come back every year to become a partner again?
I would say so. So prior to 2020, there was no auto opt-in. So we would reach out to organizations individually every year. Starting in 2020, we said everyone who was a partner last year can let us know if they no longer want to participate. And then moving forward. So I think most people do since that. And what we heard, the reason why we did that is that we heard that people wanted to be involved, but that it fell through the cracks because everyone is so busy, which is super understandable. So that was a way to kind of stay on people's radar and stay on people's calendar. Yeah, most people do repeat. Any other questions or comments or thoughts? Cool. Well, thank you all. I really appreciate you joining us. I'll drop the list of links in again, and I'll share the recording. Speakers, if you wouldn't mind sharing your slides, I'll share those as well with the group, and then the list of links. But otherwise, thank you so much for joining us. We're excited you're going to be potentially a part of CEH Day this year.